Through this, nonprofits will be able to gain understanding of the importance of data management and the tools that can enable you to structure your activities and your teams. Through this vital virtual conversation, you can identify key areas and how you can again show your impact on the community through data management. Um, I would like to now introduce you to all our speakers. We have with us Rohan Shah, who is a research associate at Catalyst Management Services. He works on research and impact evaluations and brings skills and expertise on quantitative designs, econometric models, data, and analysis. His main professional focus is economic development, livelihoods, gender, and empowerment. We have with us Desh Matre, who is the co-lead of measurement, monitoring, and evaluation at Pratham. He is responsible for the measurement and monitoring functions of Pratham's direct programs. Before joining Pratham, he worked for 3 years as a consultant at Oracle Financial Software Services, where he worked on the development and quality assurance of web and mobile apps for the banking sector. We have Karthik Menon, who is also the co-lead measurement monitoring and evaluation at Pratham. He oversees the measurement and monitoring functions for Pratham's large-scale partnership work with state and district governments. His work entails developing measurement frameworks and executing them via Pratham teams and partners so that the program generated data is effectively captured, utilized, and the impact of large-scale programs can be assessed and showcased. We are now ready to begin with our webinar. I'd like to now invite Sudesh to lead the first section of it.
Thank you, Adelina. Hello, everyone. Good afternoon, good evening. Welcome to the webinar. The text version of the introduction I feel was very technical, but very simply, we have been in Pratham for the last 5 or 6 years, working on the measurement. The measurement, monitoring, and evaluation team, we fondly call it the MME team, started almost in 2013, and we've been trying to build on what was started and learn, and then build and evolve even further. There are 2 aspects or 3 aspects of the presentation that we have today. One is I'll speak about a case study from our direct programs, which are basically learning camps run by Pratham team members in communities, villages, or schools. And Karthik will speak about measurement of these learning camps when scaled up to all schools in Uttar Pradesh. So running a program with a partner like the state government of Uttar Pradesh. So measurement involved when scaling up is something what Karthik will speak about, and we'll end with what are the key learnings that we have that we can share with you from our journey in these learning camps. So I think, Karthik, if we could move to the next slide. So quick introduction about the team, the measurement, monitoring, and evaluation team. We are 70 plus strong team members across 20 states and union territories. We have, so the field team basically consists of state MME associates and senior state MME associates, which roughly translates to 3 to 4 or 3 to 6 state team members in a state. Say for a state of, if you look at the state of Maharashtra, you can see 5 team members. One is the leader, who we call as a senior state MME associate, while the state MME associate ensures that any measurement, any data collection is done timely from the field level, and data discussions are taken up with all team members within the state. Then we have 10 central team, 10 central MME program associates, which are basically people like me and Karthik who design measurement frameworks, who conceptualize measurement frameworks, and are responsible for analyzing data, getting insights from the data, and then driving decisions at all levels in the program. Then we have a very important small team of 6 central MME technology associates, without whom we won't be able to scale up to the thousands of schools, thousands of communities and schools, and in fact lakhs of schools that we have reached in the last few years. This team is responsible for creating Android applications, web portals, web links, and maintaining a strong data infrastructure, which basically drive these insights across Pratham. So that's essentially the team. Then we have the principles of MME are basically on basically the foundational pillars of MME are 5 that we have mentioned over here. It starts with, any program starts with indicator selection. So if I take example of a learning camp, it involves learning. So learning outcomes is a very important indicator, but just looking at learning outcomes may not be useful. So we also look at attendance, participation, reach, so on and so forth. So understanding what these indicators are is quite pivotal to the measurement framework. The next is data collection and entry. So you have figured out what indicators you want to collect. You put it out as a data collection form. We call it as a data collection format or a data recording sheet, which our field team members are trained on, and they collect that data and enter it on systems. The next is training of systems and processes. Since Pratham is a basically as an organization which has 7,000 or more employees, and the scale at which we function is almost 20,000 communities. In the previously concluded campaign, we had 20,000 communities that we reached, but lakhs of schools which were also reached before the pandemic. So I think scaling up all these processes, it's quite important that training is pivotal. Training of people on systems, processes, so on and so forth. Next is quality control. Once we collect all the data, it's quite important that we verify that data. We have monitoring visits to ensure that there are strong systems to ensure good quality data that comes out. We hardly spend any time, I think we hardly spend any time on cleaning the data that we collect. So ensuring that quality data is collected in the first place and entered is something which is also quite important. And we ensure that quality also through monitoring visits. And last, I would say, is analysis and discussion. Like, just collecting data is not enough. Analyzing that data and giving it back to the people who actually collected it, and also the leaders in the organization, is quite important to drive any decisions. So all of this basically leads to continuous learning of us, of everyone within the organization, outside the organization, who are using MME systems. And the end product, we call it as data driven decision making. Like, if we follow this framework as we have put it out there, I mean, there could be other pillars as well, but the main goal or the main objective is data driven decision making. Any decision that anyone makes is based on evidence, and not just on anecdotes. I think that's the philosophy of MME. We'll now I'll move to the case study of the Pratham's learning camp. Now you've seen how our team looks like, what are the principles that we usually follow. But if we apply this to the context, which is Pratham's learning camps, this is how it looks. So very quickly, a quick introduction of what these learning camps are. It's basically a 30 to 50-day intervention with a group of around 30 to 35 standard 3 to 5 children focused on primary grades. The main objective, or the main implementation model, is grouping children as per their learning level rather than grades, because children might be at different grades of spectrum. If you look at maybe a spectrum from children who can't read even letters to children who could read a standard 2 level text, especially in a rural setting or even in an urban setting, you can find children at different levels. So it's important to group the children at their level rather than grades, and teaching them as per their level. Then periodic assessments to see progress every 6 or 10 days, and then ensuring that community visits is an important component of this. We have very recently, I think we have been very ambitious in our current remote kind of model of teaching at the right level, where we call it the catch up campaign. We plan to implement all of this through volunteers. So that's something that is to look forward to in the next 2 months. So next slide would say something about the implementation model. It starts with assessment. Like, all our programs start with an assessment, start about collecting information about children, their learning levels. Once we know what their learning levels are, we group them by grade. We group them by level rather than grade. uh, then once these groups are created, what we ensure is teaching is done as per the level of the children in that particular group, rather than again by grade, because there are teaching learning activities are aligned as per the grades that the learning levels that we have mentioned over here. As you can see in the tool, you could see something as simple as letters to something as a standard 2 level text. So even teaching and learning happens as per these levels at which children are. uh, Next, yeah. Once these groups are created, Pratham team members teach children as per their levels. They progress over time, and there is a need to reassess children frequently, so that we can monitor their progress and keep regrouping them until the objectives of the program are met, which is basically uh, reading. I mean, children who are able to read a standard 2 level text and maybe do a subtraction level problem. So I'll talk more about the tool. This is the foundation of the program. I mean, all of the entire program starts from the assessment tool, and this is one of the most important indicators in our measurement framework, which is learning outcomes. You see 4 levels over here. Children, basically, the tool starts with, when you see number one, it's basically a standard 1 level text or 4 lines of a paragraph. If the child is able to read this paragraph, we assess the child. We give the child to read a standard 2 level text or a story. If the child is not able to read this, then we basically give the child to read, say, a bunch of words and letters. If the child cannot read any level on this particular tool, then we mark the child as beginner, someone who has just started out on his or her learning journey. But the groups are essentially created as per this assessment. And the program starts with an assessment. Groups are created based on the assessment, and teaching learning starts only once these groups are created. So I think that's the teaching at the right level, and this is exactly similar, whoever does it, maybe a teacher in a government school, or Pratham field team member, or now we can say even volunteers in communities. Next, I think. So these are some broad results from basically the Read India learning camps run in 2018-19. The program has evolved over time. In 2019-20, the focus was more on community. But what you see from when all of these results are basically aggregated, when all the assessment, all the data is collected and aggregated, if you have to boil it down into one chart, this is one chart which explains the learning journey of all children who have been part of these learning camps. Is close to 200,000 students. You see, if you look at the baseline, you can see by level. Red stands for beginner, say 16% of the children were at beginner level. Then you have letter, word, and what we call as readers, who are children basically at para and story. These are 25% of children. 10 plus 15% is 25% of the children would be at parent story level, who we call as readers. By the end of the camp, once basically as you saw earlier, every 10 days assessment is done, children are regrouped, teaching learning activities are aligned, and children are taught as per these levels. You see, slowly and steadily there is progress, and around approximately 80% of the children are able to read at least a standard 1 level text in this program. Now, just looking at these results for the presentation purpose is not enough. It's quite important that we share all these results at the cluster level. At the cluster level, we share these results with a group of Pratham field team members for their own set of camps. Say if they are responsible for 25 villages, we create the same chart for these 25 villages, which is shared with the Pratham field team members, who discuss what is the progress at every end line, and strategize and create their own learning lessons for the next set of camps. At the state and national level, which is usually quarterly or semi-annually, what we do is understand what these results look like. If we have any additional questions to look at, we do some deep dives, or we try to collect more data to understand more about the results. Also take very important decisions based on monitoring, because there is also mentoring and a monitoring cadre in Pratham. So it's essentially important that those who need the most support within the system are supported, and visits are made looking at this data at every level. Yeah. Now, data entry is also quite important. Like, what is important, if just looking at this graph at the end of the year is not enough. I think looking at this graph regularly, as soon as we collect this data, is basic, essentially what we call our measurement philosophy. And to back this up, what is important is the data entry and the speed of data entry, ensuring that the systems reach the field on time. Data is entered within 2 days of the assessment. it reaches everyone in the system, say by the third day, and then by the fourth day you start taking decisions, so that there is no lag in data collection and taking decisions. To make that a reality within our own team, we have the technology team who create these apps and portals where we collect all of this data. But even if uh, you're a new NGO starting out, there are very many free tools that you could use, like Survey CTO and Google Forms. But ensuring that data collection happens as soon as it is collected, I mean data entry happens as soon as it is collected on the pen and paper, is quite important. uh, Next, what we see also is a live comparable report on this dashboard. What we also is important is not just collecting data, but for the data collector, who's the most important person and who's also running the program, they are also able to look at results in an aggregate manner, so that they know what their overall class looks like, how their 25 villages or how their 5 villages look like, and how maybe their peers are working with the children, and what their progress is. So it's also important to not just collect data and treat the person on the field who's as a data collector, but also decision maker, by empowering them with some live reports through our apps. We do it through apps, but there are other tools which you could also use. So next one, what we do is we create Tableau dashboards. The entire MEE team is very much high on Tableau dashboards. There are also many team members who are attending right now who have created these Tableau dashboards. We have one portal where we put all of these Tableau dashboards together. We call it Pratham Insights. You could call it for your NGO. You could create a web web portal like this and collect all the dashboards together. But this one dashboard ensures that data is dynamically shared with everyone in the organization, because we definitely create presentations. We do it for our national leadership, for our state leadership, but it is important that there is transparency and accountability of basically looking at data, availability of data, access to data throughout the same system, so that everybody knows that this is the data which is collected and this is how you look at it. One important thing maybe which I didn't cover earlier was we don't collect data for every child, because that takes a lot of time. What is important is we try to uh, reduce the effort of data entry and collection, I mean basically the data entry part, by aggregating data at the school level. And what you see over here is aggregation of data of all schools within the system. So I think this is a dashboard. This is one sample of a dashboard. You can see there are 6 tabs, but basically there are 10 tabs in this particular Tableau dashboard. Each tab is for a particular audience. Some tabs are for the leadership, some are for cluster leaders who are responsible for 5 say Pratham field team members, and there are also tabs for Pratham field team members who can look at it on their mobile phone, or with the help of their team member on a laptop. uh, so I think this is essentially how we collect data, report it, analyze it, and basically share it with the entire organization, not just the leadership, but from everyone. In fact, from the leadership to the last person in the field. So these are some important decisions that basically anyone could look at before you think about your data journey. At the organizational level, I mean, these are high impact decisions taken quarterly, but these are key strategic decisions which will change your program. So if you have a certain hypothesis about the program that you're thinking about before starting the program, your measurement framework can be modeled in such a way so that you get answers to your questions during the year. And when you go back to changing some aspects of the program, you have the data handy to take these key strategic decisions. For us, it is usually uh, earlier it was just looking at 1 year's data, but now we have started looking at multi-year data in one particular geography, which helps us build interventions or model interventions for the next year, and also prioritize age groups. Like one of our examples was from one of our data sets. What we figured out was standard 1 and 2 children have suffered the most during the pandemic. Hence our focus during any particular campaign should start with standard 1 and 2, and then maybe move to higher grades. Next, at the cluster or state level, what is important is tracking implementation progress. I mean, because things move so quickly within Pratham, they are as per a very tight schedule. It's important to track this implementation progress, very quickly identify problem areas, and as a solution, create priority based visit plans for our monitoring and supporting cadre. We have a monitoring and supporting cadre who visit field team members. So it's quite important key where these problem areas are, so that the monitoring and supporting cadre could visit them. And decisions are here are taken basically on a weekly and monthly basis. It's basically the entire cluster or state team would sit together, look at the data, what they've collected during the week or during the month, and take basically plan for the next month or next week accordingly. At the field level, what is important again is, I mean, this is the first point of data collection. I mean, this is where data is available on their own pen and paper formats, as we call them, is by, I mean, children's levels, then the learning levels of children, their attendance. Some decisions could be taken at the field level as well. If a child is not part of, say, these learning camps, the attendance is not so great, so it's important for the field team member to just look through his or her sheet and then visit that child accordingly. I mean, obviously, all of this that we are discussing is pre-pandemic. We'll maybe address some questions about how to do all of this post-pandemic, like what have been our strategies. But what is important is to acknowledge is it's not just the data which is entered or what you collect as data is, which is something the most important, or what you see on a dashboard, but even the data which is collected on a pen and paper format. For us, it is learning levels. In fact, everything. Even for that particular group of 30 children, some decisions could be taken by our field team member who's actually running the program. So these are basically decisions taken daily. So this is in a nutshell what we do in learning camps run by Pratham field team members. I'll hand over to Karthik about what happens when you scale it up to lakhs of schools, basically a lakh schools in Uttar Pradesh.
Thanks, Sid. Good evening to everyone. Thank you for Thank you to ConnectFor for hosting this webinar, and thank you to everyone for joining and listening to us. As Siddesh mentioned, I'm going to be speaking about how we've taken whatever we've done directly, as what Siddesh just showed you right now, and how have we implemented those learnings, those processes to a large scale system. Because Pratham works in two ways. One is through its own staff members, through its own teams, which are spread across the country, but also in collaboration with the government. Because at the end of the day, every child in school and learning well, we want to reach everyone, and working with the government will enable us for that. So I'm going to give you an example of a government partnership program that we ran with the state of Uttar Pradesh in 2018-19, which was actually a very good use case of how data and technology was used at different levels. And of course, we had our own reservations right in the beginning before starting all of this off, to say that, can this actually be done at such large scale with so many people across the state of UP? The short answer is yes, we were able to. And in today's session, I'll walk you through the different key processes that were there in the government partnership program. And at each process, what was the data collected, how was it collected, and more importantly, what decisions it actually enabled everyone to take based on that data that was collected. So just a bit of background before we get into what the key processes were. In the course of the entire program in Uttar Pradesh, we were able, and this entire program was based on teaching at the right level that Siddesh had just briefed you on. Assessment played a very key role in all that, and it was targeted towards grades 1 to 5 in all primary schools in the state of Uttar Pradesh, which totaled to about 110,000. And it was implemented by 2 teachers in every primary school. And in the process of the program, we impacted about 8.7 million children across the board. We were able to collect data from 8.7 million children, at least through our systems and through the program. More importantly, whatever we did was actually, it was the government that actually did it, with Pratham playing a supporting role, providing technical inputs from time to time, and wherever we were there in the field, we would participate and support in whatever activity was going on. On the basis of this program, I'll highlight what was the broad outcome that we saw, because it's great to run a program, but did it really achieve its goal? And the goal of the program, in very simple terms, was to significantly improve basic literacy and numeracy skills of all students studying in government primary schools in Uttar Pradesh. Even though the program ran only for about 45 to 60 working days, because for a variety of reasons, the duration of the program was short, but it was at least 45 days. We saw a 22 percentage point increase in the ability of a student in grades 3 and 4 to read at least a standard 1 level text. Now that's, you may think that 22 percentage points is a small percentage, but when you see it in terms of millions of children who have actually enabled, who have achieved basic reading ability, that it's quite significant. And it was all done by government primary school teachers with the support of the state and district administration. So that was more or less what was the output of this program. Today, what I'll talk about is to implement such a large scale program with so many stakeholders, so many teachers, so many children. How do we go about doing this, and how do we ensure that technology can be an enabler and not something that becomes a barrier in all of this because of variety of reasons? So we'll share our experience. Of course, there has been some evolution from what we have done. This was at least 2 years ago we did this program, but some of the principles have remained the same, and we feel a lot of our learnings can actually be applicable to any other setting. Even I'm sure a lot of people are here from NGOs who partner with government either at the state level or at the district level, and some of what we're going to share right now may most likely be applicable to you as well. So I want to highlight there were 5 processes within the program that was implemented. The first part was like, and this is very typical, I'm sure a lot of organizations follow the same process, that there was a training of a district and a block level team. Then this district and block level team actually implemented the program themselves before taking it forward. Once they had implemented it themselves for a short period of time, just as a way to become more comfortable with the methodology and learn by doing, then they took that to the teacher, and you can see that the scale keeps on increasing. We started off with 300 or so district level resources, then they became about 3,000 block level resources, and eventually we reached about 2 lakh teachers across the program. And then once the training is done of those 2 lakh odd teachers, they actually implement it in the classroom they implemented it for about 45 to 60 days. And during the implementation of it, this cadre that was created at the district and the block level, who were existing government resources, continuously monitored the program and provided mentoring support to the teacher, as well as did review at various levels, at the cluster, at the block, at the district level. So now for each of these levels, I just want to share with you some of the data collection processes that we had, the tools that we used, and what outcomes we could really see from it. So the first level of training at the for district level resources or block level resources, we actually use very simple Google Forms because they're user friendly. Everyone knows them. They're easy to deploy, and you can get data very quickly. Again, it has its limitation when you go into millions. But if your group, if the sample that you're collecting data from is relatively small, at least at this level, Google Forms are a great tool. And we collected very basic indicators of the participants' profile, their phone number, and we were able to track attendance. Now, this data was quickly analyzed and given back to the district team so that they could first track attendance, because at the end of the day, we're using a cascade model in training and we need to ensure that everyone is properly trained. Please remember, all this program was done at scale in all 75 districts of Uttar Pradesh. So tracking of the implementation was key so that the sequence of activities are done correctly. If there was any inconsistency that we found when we collected this data, it could be immediately reported. And lastly, we were going to introduce, and this was actually the first time we were doing this at such scale, we were going to introduce a Pratham developed app. But prior to that, we actually needed to know what the technology infrastructure was available. So we had to collect very basic information about the phone type, their model, do they have the right Android version? So all those details were quickly collected, and we were able to really gauge if whatever technology plans we actually have in place can really be rolled out or not. So quick, lean data we got from just Google Forms. Then once everyone was trained, they were also trained on the app itself, the government partnership Android app, we call it the GP app. And through case-based techniques, we were able to train everyone on how to download the app, what are the features of the app, how to input data on it, and what output is seen. They were able to understand. What data were we collecting in the app? Very straightforward data, two types. One is assessment level data at baseline and endline, as well, and which is inputted by the district level or block level resources, and process monitoring indicators, because in the implementation of this program, the DRPs and BRPs are the monitors or the mentors. So they need to be familiar with what are the indicators that we need to see during a classroom, so that they can provide, not only provide input to the teacher, but also report at different levels. What this enabled us to do was, because the app was in the hand of the person who was implementing the program, it developed a certain buy-in from them, because they actually implemented the program and they saw results and they inputted into the app, they saw the outcome of it. And we feel, and this was actually widely discussed as well as acknowledged, that, you know, if you do it yourself, you see some results from it also. We saw about a 17 percentage point improvement when these practice classes were done. There is more, there's more ownership into the program, and you really believe that this methodology works. It's not like you're taking some external evidence, someone else has tried it and they're telling you to do it. You did it yourself and you actually got results. So this entire practice class, with having data on their fingertips so that they could even discuss it at different platforms, was crucial to the successful implementation of this program. Then obviously came the very large teacher training that had to happen simultaneously across Uttar Pradesh over a significant period of time. And I'm sure everyone here has delivered trainings in various forms, very innovative ways, but doing it at scale is also a very big challenge. And tracking of that training is very important. So again, we kind of quickly use Google Forms here and created a live dashboard, so that leadership not only at the state level, but at the district and the block level, could really track what the entire picture of training is. When did training start? When did they end? Was material available in the training? What are some of the challenges, technological challenges that anyone is achieving? So we were to empower state and district teams to have a fair idea of what is going on the ground. Here, another thing that helped the master trainers or the BRPs, DRPs that I just spoke about, they had their own experience and their own data. So they were able to really present it to the teachers as well and say, you know, I've tried this, it works. And I'm sure if you do it for a longer period of time, it can have even more impact. So data actually enabled this conversation. Of course, all conversation is not around just data, but at least a conversation starter, and just collecting this very simple baseline and endline data during practice class enabled that. Then we went into classroom implementation, and this was something that was really brand new for us as well. We pride ourselves on working at scale, but this scale was significant. And usually our assessment data, which is key to the intervention, is collected by the district or block level cadre, because we don't want to really burden maybe the teacher in data entry. But at the end of the day, the teacher does the assessment. So I wouldn't say took a gamble, but we took an educated guess, and we said, let's try it out with government school teachers. So 220,000 teachers were trained on the government partnership app, and they were the ones who entered data for assessment. They also had a pen and paper format, and it was just not an one-way process. Because they inputted data, they were able to understand the class profile, what child is at what level, how many groups they have. They could track progress over time. If they could track progress of the group, and using the format, they could track progress of each child and actually identify those children who are probably not performing as expected. When the mentor monitors were coming to the class to actually see what the teacher is doing, they were actually speaking the same language because the data that was collected was available to everyone because they were using this common platform. And most significantly, which we found was that because teachers were doing data entry, there wasn't a lot of lag in the data actually coming, because a lot of times it is someone does pen and paper data entry, someone collects it, deposits it somewhere, someone else does data entry, and finally you get the final output. But here directly the teacher was doing data entry. Lastly was the monitoring and mentoring and review, again using the same platform and the dashboard. BRPs and CRPs collected process monitoring indicators. Here also we kept it very lean. We only focused on 4 or 5 indicators, which are indicators that could help guide a conversation or highlight a major problem. For example, if material is not being used correctly or assessment has been done correctly, there was a layer of verification that we had put into place also, and this was done by the BRPs and the CRPs. This enabled the dashboard as well as the app enabled the monitors to actually prioritize their visits, because they had access to the data that teachers had put, because they had access to process monitoring indicators. They were able to prioritize who they should visit and what should they really talk about. Now, one is discussions at the school level, but they could also have discussions at the cluster, block, or state or district level as well, because there was data. At the end of the day, the data, as I said earlier, is a conversation starter. It is not the be all and end all of the program, but at least it gives you an indication of what you should discuss. Then obviously through their observations, the demonstrations that they've given, there could be rich discussion at the at different levels within the system. This is just some of the outputs that we saw from the monitoring visits. Just on the last part, I just wanted to highlight that initially when we rolled this out, there was a lag of about 13 days between the teacher doing the assessment and entering it on the government partnership app. After that, it was the mentors and monitors who continuously visited schools, spoke about data entry, solved their problems, and we saw that gap reduced to 6 days by midline, which is about 30 days into the program. And by the end of the program, that lag was actually only 1 day. So for us, this was some sort of evidence to say that, you know, when people are visiting, speaking to the teacher, they are able to problem solve and resolve those issues. And we could really see evidence of that also. And at the end of the day, we did get data for about 8.7 million children, the learning level data. So I'm almost going to end here. From Sidesh's presentation as well as mine, what did we learn? And we feel that maybe you can learn as well. And we would love to hear your thoughts and comments. The first is that it's important to invest in a mentoring and a monitoring cadre. Of course, they should have complete understanding and knowledge of the content, the methodology, whatever your intervention may be, but they should also be well equipped in data collection and how to really use that in their day-to-day so that they can improve ongoing implementation. Second is, and this may not be feasible everywhere, but if it's possible, collect data by the implementator themselves. The person who's actually doing the intervention knows the situation on the ground, but ensure that it's not only reporting, that I just collect data and then keep on pushing it upwards. It should be shared with the implementer immediately so that they can also understand, interpret, and take action on it. Of course, when data gets collected, it can be aggregated to see a big picture. It can be disaggregated to see smaller units. It should be in a way where you can compare and contrast. So data should be aggregated and disaggregated in different ways. Of course, there are so many platforms out there. We are not advocating for one over the other, but there are Google Forms. Tableau has a public version also for dashboard. Survey CTO is there. There are lots of different platforms which all have their pros and cons, but definitely there are a lot of tools out there which can be utilized. The approach that we have taken, and we've invested a lot of time, energy, and resources into developing an in-house technology team, which is agile and can really develop Android applications and web portals which are completely aligned to the program and can connect different stakeholders. May not be possible for everyone, but it is actually quite a boon and is quite helpful. And we took that same infrastructure and actually gave it to the government, so it can actually be utilized by other partners as well. And finally, keep things simple. At times when it comes to data, limited people see it and it becomes complex, but try to see data as a conversation starter. Choose indicators which are simple and useful, and the output of it, like everyone can assign the action to it, is key. So that's all that I have to share today. We would love to hear what everyone thought about our presentation, would want to know more. Adelina, I'll hand over to you so that the next session can start.
Yeah, thank you so much, Sudesh and Karthik. It was a beautiful presentation. We've got a lot of questions, and I see Sudesh has answered most of them. Keep sharing your questions in the chat box. I'd like to now invite Johan to lead the next part of our webinar.
Hi everyone, thank you Adelina for the introduction, and thanks Sudesh and Karthik for discussing about Pratham's work and how the MME team at Pratham undertakes use of data and the processes that they have. I'll be talking more on the side on the lines of application of data for the day-to-day operations, as well as during the entire project life cycle that most of us work with. I'll be sharing it from the organization's experience over many years, and yeah. Yeah. So CMS is an organization that works with change agents to scale impact and impact the sustainability of the change agents and our partners who affects the SDGs. We do that through resources and solutions. Some of our solutions include designing of interventions, supporting uh, uh, evidence evidence-based decision making, monitoring of their programs, and among others. So I'll be talking about how data can be applied by NGO for themselves, for the community that they work for, and the sector that they work, and the sector and the policymakers at large. So firstly, I'll start. Before that, I would like to bring forward this that there are these four major questions that each NGO during any of the program or its own life cycle ask, that what is a program that is required by the community that I'm serving or working for? How much is it going to cost, or how much am I spending for this? How much can I spend for it? What am I doing, and does it really matter? So this encompasses the entire project life cycle of most NGOs. So the first question that comes is, what do I do? I mean, what program do I need to implement? And this applies to data for intervention design. You have collected data, you have processes up for data collection. You have a certain set of data through collecting them yourselves, or you have secondary data. How do you apply that data for your intervention design? So there are many methods, and I'll be talking about two methods that we have used. One of them is formative research, using data to understand the issue and the extent of the problem, and what it is getting affected by and what it affects. So the relationship of the community, the problem, the specific area that an NGO wants to work with, and how that works in the entire ecosystem that you are going to, in the end of the day, going to work with. So Breakthrough is a women's rights organization that was planning to implement an intervention to increase the age of marriage of girls in Bihar and Jharkhand. Now, it was like most gender programs, it was directed towards girls. It was intended to increase school enrollment, increasing years of schooling so that the age of marriage gets delayed. However, during the initial data analysis, during the initial formative research that we undertook, uh, and the and one of our partners, Praxis, undertook, uh, there were key factors that were emerging that helped breakthrough understand what affects early marriage. And something really interesting came up was how men and boys are drivers of change in a setting where you want to increase the age of marriage of girls. So the program does not only need to focus on girls and young women, but also on men and boys. Another one of such example was Karnataka Health Promotion Trust. They work with vulnerable communities, women in sex work, uh, and, and population which is at a high risk of getting infected by HIV. Uh, something sort of a qualitative, something of sort of a geographic mapping of the number of such populations, such groups, and the location, help them scale up their program and understand that the problem that they're thinking of dealing with is not small but widespread, and they would need more resources to have effective have an effective intervention. The second use case is applying data for self, for the NGO themselves, but for program and financial management. This includes the M&E data about inputs, activities, outputs, processes, outcomes, uh, learnings. Some of this is already covered by the presentation by Siddesh and Karthik, how Pratham regularly collects data on inputs, activities, outputs, and outcomes for their day-to-day decision making. I would bring in the other aspect of finances, so financial management. Sometimes NGOs struggle when it comes to donor reporting or risk mitigation in case of, say, pandemics where your deliverables are getting changed or so. If you are collecting program data, linking it to the financial data, or linking it to your day-to-day activities and your deliverables and your contractual obligations, it helps understand the progress against plans, differential progress, what you need to prioritize, how to uh, how to forecast what is going to happen, what progress you can expect, and then if it needs shuffling deliverables also. So this is a different aspect, not just related to your program that you're or the communities that you're working with, but using data for your own self and having a better administrative and financial management. The third aspect is one of positioning and fundraising. Not many NGOs again think of data in terms of positioning and fundraising. These can be as simple as case studies or storytelling, media campaigns or so. But if it is backed by data from your programs, from your challenges that were faced during program implementation, or opportunities that you came up, unintended aspects of the program that you came up during your program, are sometimes very effective in positioning of your organization, of your program, and as well as fundraising. Uh, Action Collab is one of our projects that works on reducing vulnerability of key population of our vulnerable communities and help them survive and thrive in the pandemic situation. Uh, we have been able to raise about 40 million uh, uh, funding through effective communication of the data that we collect for our regular M&E work for the program. Uh, Another aspect of, moving forward and away from NGOs' own self, moving it to community. So applying data for community management and impact assessment. A large number of programs these days look at groups, self-help groups, community institutions, be it producer groups or be it an FPO or so. Uh, it's a very important that you help the community understand the data that we are collecting from them. So as Karthik mentioned, not just pushing data up, but also pushing it, providing the data back to the implementers. I'm saying providing it back to the community to help them realize and figure out for themselves where they are. So things like community scorecards, which is a simple data on membership, program initiative, resource mobilization. So Avahan was another one of our programs where we worked on the empowerment of women in sex work. This was implemented through community-based organizations. So the CBOs worked with the key population and uh, help empower the women in sex work. What we helped them with was to create, we facilitated them to create baseline measures, uh, which help them identify gaps and plan for improvement. So when programs are delivered through community organization groups, such kind of system really help course correct, provide them insights on and provide insights to the leaders of such institutions uh, to monitor their progress and assess the impact themselves. It's about empowering communities through the data that is being collected from them. Another aspect of and probably a larger aspect of most work that we do is to go back to the sector, go back to policymakers and um, and uh, and talk about how a particular intervention solves or finds a solution for a problem, a unique problem that exists in the communities. Some of the classic methods are impact assessments, uh, outcome evaluations, impact evaluations, or maybe it might be more academic in nature, where there are papers being written on certain aspects of and taking it to an audience, to a larger audience of policymakers and academicians who are experts in their field. This helps in understanding the changes, the impact, and also a very crucial aspect of it is expansion and scaling, because it helps you understand what's working and what is not. Uh, we along with 3IE did an impact evaluation of NRLP, which is a flagship program of Government of India when it comes to rural development and live poverty alleviation. Uh, it was an extensive impact evaluation where we collected data from 27,000 households across 9 states of India. Uh, there was definitely a report being put out that helped the ministry understand how it affects, because being a poverty alleviation program, but with a focus on gender, with a focus on empowerment, there were many aspects of the program that were not, that was salient in the start of the program, but picked up over time. And such evaluations, such impact evaluations, where you're using data to understand what's working, what is not, really helps to scale up, course correct, maybe take the program to a next step in the way that NRLP and in the way that the impact evaluation helped NRLP uh, in designing the National Rural Economic Transformation Project, again funded by World Bank. It helps policymakers answer questions in the way MORD cited the report to answer the questions raised in the parliament. So, and we are using the same data, going back to SRLMs, giving them the data that we collected. SRLMs are using the data to go back, course correct, understand what worked, what not, at their own specific state, district, block, and even at the village level, where they are able to identify the problems that's going on in their state. The major learning that I would then talk about would be how you apply data. So there's data that you collect, but then the same data can be applied to different cases if the purpose is different. So firstly, need to understand the audience that we are catering to. It's not just the data presented in a dashboard or in a graphical form or in a tabular form leads to better decision. It's about how you use the data, for what you use the data, the same data on if you want to your financial forecasting or fund management or cash flow management or something. You just don't need data on your funding or spend, but you also need the data on the larger sense of how the program is, because it helps you understand that how much have you progressed and what more you need to do, how you're spending. So yeah, this is driven by the data being collected, quantitative, qualitative in nature, what specific data is being collected, who is your respondent, the methodology in which you collect data, be face-to-face, one-on-one surveys, and the kind of rigor required for the data being collected for the specific purpose that you are looking at. Thank you. I'll stop for now and then probably take up questions. Over to you, Adli.
Thank you so much, Rohan. We do have a couple of questions here. Just a second. The one question we have is, while working with women, what tool did you use to track the outcomes?
Sorry?
Yeah, while working with women, what tool did you use to track the impact outcome?
We use multiple methods. We use a decision-making index, which is a very standard tool these days when it comes to understanding empowerment. There is another. There are set of tools that are available. One of them is decision-making, which helps you understand what is the relative position of the women within the household. It comes from the literature of household bargaining and individual bargaining. That is one of it. The other aspect when it comes to understanding women's position is also not just restricted to household, but also to look at it relative to how they are communicating outside the household. So maybe it be with a PRI member, be it with other line departments, be it with other organizations working in the village. So there is another agency tool. You need to understand network. So there are a couple of tools available, but it needs to suit the purpose that you are trying to what you want to capture, what's your question that you are trying to answer through data.
And if there's any data-driven change that you've noticed to get policymakers to review a policy to women, could you share on that too?
So there's a working paper which I have co-authored with some of my colleagues that studies the impact of funding on SHGs. So on women's empowerment. So does providing higher and better, larger amounts of fund to to a women through SHGs increase their empowerment within the household? And we do find that there's a positive. There's a positive effect. And we have been able to establish that causal link that giving funds to women through SHGs does improve their empowerment within the household and the decision-making capacity within the household. And that is just not restricted to things like day-to-day household decisions, but on a range of outcomes. Through this paper, the ministry has been able to make sure that the funds that were, so there are no delays in provision of funds to the SHGs or the women. There's a set amount of minimum set amount of funds that is being given, such that each member that is receiving the funds have sufficient amount of fund available to them to take up those enterprising roles. So yeah, that is one of the many cases where the evaluations or the results have actually impacted policies.
It's already 5:05. Rohan, I believe we have a cut short time at 5 p.m., right?
Yeah, I can stay back for another 5 minutes if there are questions, or I can answer them over over questions, over an email.
Yeah. So I'd like to invite even Sudesh and Karthik for the final two questions. Um, One is on what are the major challenges faced during the M&E framework formulation and the implementation process, and how were you able to solve it with a partner, like especially the government partner that's involved? Maybe we can have Rohan picking it up uh, and then followed by Sudesh or Karthik. Does that work?
Yeah. Sorry, Adelina.
I could repeat. Yeah. Would you like me to repeat the question?
Yes, please.
What are the major challenges that were faced during the M&E framework formulation and the implementation phase? And how were you able to solve it with the partner who was involved, especially who was a government partner?
So when developing an M&E, so when developing an M&E model, especially when you're working with government, uh, what's important is to understand what capacities that you are working with. There are certain data, I mean, especially when it comes to government, there are data privacy rules. You can collect certain amount of data, you cannot. There's there's sharing. So communication is key when you are working with partners to collect data. Uh, what there so laying out bare minimum that you need for effective monitoring of the program, and then there are questions that you would like to have, so laying them out, differentiating between them, and then having an effective communication with your partners, especially government, uh, will be very important uh, when you're planning your M&E framework. Over to Karthik and Sudesh.
Yeah, actually, just building on Rohan's point, that one is definitely have very clear communication of why you're collecting data and what are you going to do based on it. And secondly, what he mentioned about capacity, everyone having that capacity to really digest that data is key. The third part that we actually saw was that data shouldn't be used as a punitive tool, that it shouldn't be, oh, you have to collect it, you have to report it, and then only you will get XYZ. It should be used as a collaborative means to start a discussion. So those are some of the challenges that we face, because a lot of times in the at least school system we've seen data just flows upwards and there isn't a lot of discussion about it at the level that is being collected. So those are some challenges that we faced. A lot of times having another entity there just to nudge what type of conversation needs to happen, like Pratham does have people in the field, helps the cause. But yeah, I would say these would be some of the factors.
Just to quickly add, I think usually when we work with external governments or even within our own teams, everybody wants to collect a lot of data. That's a challenge. I mean, ensuring that how to prioritize your indicators, reduce the number of columns, maybe have as many rows as possible. You can reach out to as many schools as possible, but convincing government officials, even some of our program leaders, that okay, this is the data that is required. I think that's one challenge, but yeah, I think that's useful. Once you have collected the data for 2 or 3 years, then you know what actually works.
Thank you, Rohan, Karthik, and Sudesh. The final question we have from our RSVP form is how can we show qualitative impact through data?
Well, we can take this, and this is a big complaint that we get within our organization as well, that we collect too many quant indicators and not enough qualitative stuff. But the whole point is, which I've repeatedly said, data is just a conversation starter. That's where you actually link your subjective, what you've seen, anecdotes, and back it up with data, with evidence. So we routinely within the organization or with a partner have review mechanisms where all of this is shared. And that's why data is so vital, because it should be there during these review meetings. You can't have a review meeting where everyone is just sharing stories without any evidence, or you can't have review meetings with just people showing data. It has to be a very close combination of both, and that way at least subjective information is brought to limelight. Of course, we haven't cracked how to collect qualitative data at Pratham till now. Rohan, Sudesh.
I think just from the direct programs example, usually at least, so there is a monitoring visit which happens, which we spoke about, right? So if someone needs more support, there's a monitoring visit. Both the monitoring, we call it monitoring and support visit. So rather than waiting to collect that data to the central level, analyzing and giving it back, what we use this data is to flag any actionable item then and there. So there are certain executive decisions that we leave at our own team members. That's how I think we essentially convert this qualitative data into action at the field level. So we don't have to collect it. It may not reach me, Karthik, or the MME, central MME team as such, but at the field level, certain decisions could be taken based on a monitoring report or a visit report that someone has compiled, or some using based on the visit.
What we usually do when it comes to qualitative is we use it to, we use sequential methods sometimes where we collect quantitative data, analyze it, and go back and look at it very qualitatively to explain the data or nuances that we are finding in our quantitative analysis. So finding meaning to the data that we already have collected. Why are we observing certain patterns, especially when they are not in the direction that we had anticipated. So that's where we use qualitative data significantly. There are uh, there are there are ways in which you can simply use qualitative data standalone, especially when you're doing things like needs assessment or understanding the context from say policymakers, governments also, or other government or donors or foundations also, on what are their needs, what are their expectations in terms of a program or so. So it's not just data that is being collected from community that needs to be talked about, but also data that flows across the organization that creates its own data, and also data that you get from governments and your interactions with other stakeholders. And most often those data are in qualitative form. So need to figure out what are the nuances that are coming out of it.
Thank you so much, Rohan, Karthik, and Sudesh. We can now conclude by thanking all our speakers. We have gathered really excellent insights today. Thank you so much to our attendees for joining us for this session and for being a wonderful audience. I request you to please fill the feedback form as it will help us to curate many more sessions like these. My team member Aishwarya will be sharing the link to the form with you in the chat box right now. As mentioned earlier, if you have any questions that have remained unanswered in the session, please put in your queries on the feedback form, and we can request our speakers to answer them post the event via email. We are thrilled to be organizing the webinar on strengthening our digital presence to volunteers. The event is scheduled for 11th August. We'll be sharing the link with you shortly. Through this webinar, you can get an in-depth knowledge on quantifying the value of a volunteer and understanding the role that social media and website development volunteers play in your organization. Thank you so much, participants, and we'll see you all soon. Take care. Bye-bye.
Thank you so much.
Thank
Thank
you.
you.